we're here to make it easy for you. And, I pride myself on education and making it simple.
At the end of the day, your goal is to make sure that they have the best coverage for themselves.
My favorite compliment when people say, you really made this easy for me. One of the first things I like to say to people is just relax. I'm going to hold your hand through this process. We're going to get through this together.
People will be much more willing to change their insurance than change their doctor.
Medicare kind of doesn't change someone's life, but putting dollars back in their pocket really does.
Not every plan is created equal, and not in every area either.
And I always say to people, look, if it's something that's medically necessary, your doctor should be able to find a way. That's great. It makes me feel like I'm doing what I need to be doing.
Somebody's an expert on a topic when they can take something incredibly complicated and complex and make it so simple that anyone can understand it. Welcome to this edition of the Medicare Made Simple podcast with MediConnect. I'm Lance O'Brien, and today I'm here with Dawn Clark. Looking forward to being with you. Dawn, you're one of our benefits executives here at MediConnect.
True.
What does that mean?
What does that mean? That means that I field phone calls from people either new to Medicare or looking to maybe change their benefits, somebody who's looking for something different, try to find a more appropriate plan, help them make sure their doctors are in network, medications are covered well, just make sure we cover all the bases so they're on the most appropriate plan in the area for them.
So essentially for the last 5 years or so, since you've been with us, you've been helping people with their questions, navigate plan changes with Medicare. Right. You deal with a lot of probably anxiety that they might have. But at the end of the day, your goal is to make sure that they have the best coverage for themselves.
Yeah.
Yeah.
Mm-hmm.
And why are you passionate about this?
I've always enjoyed helping people. I've always wanted to be in the business of helping people. So this is a really tangible way you can help people. You think Medicare kind of doesn't change someone's life, but putting dollars back in their pocket really does. So.
Especially when they're living on a fixed income, things are tight, and they're just trying to really figure out, how do I stretch my dollar without sacrificing my coverage?
Right.
Right. So excited about this episode of the podcast today. And I know as we're talking about stretching the dollar, it has been a little bit challenging in the last few years because we've seen a reduction in benefits for the individuals. Can you just talk a little bit about, as you've been having conversations with people, appointments with them, what has been the biggest impact that they have faced as far as reduction of benefits?
Sure. The changes in Medicare with the donut hole elimination, which sounded like a great thing and is, but the carrier's answer to that was a $615 deductible. Most people aren't used to having to pay that much up front. So that's been a big impact. And then we've seen a huge reduction in those over-the-counter benefits, which is another place that kind of hits people in their wallet, because they're used to they can have food benefits and all kinds of allowances in that kind of bucket.
So the medical benefits, if I'm hearing you, have kind of stayed pretty decent, but the drug coverage, the dental, vision, hearing, over the counter is the vitamins or other things that they could purchase through an allowance on their plan. There's been a reduction in those. And the reason I really wanted to talk about that at the beginning of today's episode is because there was a recent news that just came out, the advance notice. Advance notice is sent out by the Center of Medicare and Medicaid Services every year, and it's a shadowing of what next year's plans are going to be like. Well, one of the things that the insurance carriers really look for during this time is how much increase they're getting from the federal government, right? Like all of us, right? We want to know how much increase we're getting. And they're going to get 0.09%. So not even one full percentage point. Now, again, this advance notice isn't the final notice. So there's a bunch of lobbying and other things going on right now. But at the end of the day, the initial forecast is that there might not be a lot of reimbursement. So we could see some ongoing, maybe steady premium, or not steady premium, steady copays or some reduction in benefits. So we know with this kind of flat reimbursement, there could be some drawback on some more benefits, or they could adjust the plans differently. What do you think would be some of the biggest challenges that could happen?
Well, I know last year the biggest thing was people going from plans that have a $0 copay for things like a specialist or maybe $10, something pretty light. Um, Big jumps to 25, $35, those have an effect on people that, see a lot of doctors and things like that. So I would say just an adjustment in general on those types of things.
Yeah, so we've seen reduction in benefits. Now, probably you're right. The next step could be increasing copays a little bit more, increasing the premium of the plan. So, breaking news we're looking at, again, they're able to lobby on this through the end of February. And then in April, the final notice comes out. So we'll have a lot more information for people then, but very important for them to know that, we're looking at not just what happens October, because I mean, they get bombarded on the TV. Like their Medicare life is wrapped up in that time period. Ours is really wrapped up in everything that builds to those moments before we get ready to meet with them.
Right.
So Dawn, we're in the month of love, getting ready to come to the end of February here just in a few days. And I thought it would be great today for us to kind of talk about some of the love-hate that comes as a result of Medicare.
Sure.
Right. So like in your mind and dealing with people as often as you do, what do you think they love about Medicare?
What do they love about Medicare? Anything they can get for free.
I think that's a great answer, actually, right? Like zero premium, free utilities, free
groceries,
food, right?
Yeah.
Who doesn't like free? And why is that, do you think?
Because everything's so expensive these days.
Everything's so expensive, and it's because they're living on a fixed income too, right? Like, so that's the one thing about seniors that I think maybe some people that don't work with them all the time like we do don't realize. Like, if I need to go out and make more money, I go out and find a way to make more money.
Right.
For a lot of them, that opportunity is not there. Of course, they can do it, but it's much more difficult for them, right? So, like, yeah, I think they love free, zero premium, zero copays, all of those types of things.
Right. And they feel like it's something that they've earned, they're entitled to. So kind of rightly so, I guess, if you will. They've worked for this their whole life and they feel like they're entitled to these benefits and these perks, and who can blame them?
Yeah, no, and you're not wrong. And I think we hear that a lot is like, I thought all of this was free, right? And, that's probably a topic for another podcast, right? Because we know it's not all free, but they definitely love free. So one of the things that they hate is when they get it for free, but then they have to deal with networks or prior authorizations. Why is that so difficult for them?
Well, because they don't want to be told no. They don't want to be told where to go and which doctors they can see and can't see, but that's kind of where we come in. So we can help them make sure that they stay in the network or they understand what their network looks like so they don't run into those problems.
Yeah, so I think it's actually basically the human race, right? Everybody loves free or low cost, and nobody likes to be told what to do or when they can do it, right? So it kind of makes sense. And, when it comes to our healthcare, obviously it does take on a level of seriousness, right? Because like if you have a really important medical need and you can't see the doctor that you want to see, or things of that nature, I mean, that can become really frustrating. But again, we focus on making sure that doesn't become a hate for them, right?
Right.
And how do we do that?
By looking at, what their current list of doctors are, who do they go to see, what networks do they typically tend to lean on, in certain areas. You just get to know where certain plans are going to work better than other plans.
And I like the way you said that, because not every plan is created equal and not in every area either, right? Like you work not just in the state of PA, right? You work in many states, 30 states in the country, right? So like, that like what might be offered here in Pennsylvania is very different than what might be offered in Maryland per se, right?
And it might be the same carrier, but it's a different plan, and the benefits on certain carriers are really nice in the South. They don't work great in the Pittsburgh area, so it really just depends.
Which some people will be like, why can't I get what they have?
Sure.
Right? I'm sure you've heard that a ton of times. Or I lived here and I moved here and it's not the same.
I was just going to say that.
Right. So like, but it really does have to do with territory that matters.
Right.
So we love free. We don't love to be told what we can and can't do, or what doctor we could see, or what medical procedure we want, and maybe we have to have a hang up. We don't like those things. I do want to go back to something we touched on briefly, and I want to come at it a little bit differently. How people think that they're entitled to all of this and that, it should all be free.
Right.
Right. Well, what people don't realize is, and it's not that I don't disagree with that. Like, people work a lot. They should get the best healthcare they can. And that's kind of the point I want to make is a lot of times we help people compare their employer plans
Mhm.
to Medicare.
Mhm.
And would you say generally that Medicare can be better than employer plans?
Well, it definitely can be less expensive. And, the couple things that I tell people always to look for is if you're on an employer coverage, first of all, who's paying for that? Second of all, is it a high deductible plan? 'Cause sometimes it's a high deductible plan and they don't even know it's a high deductible plan. And it might have access to certain services before the deductible, but that's an important factor because most of your Advantage plans don't have any kind of a deductible.
Yeah, you go from group coverage where you're paying more out of your pocket up front, and then you're going to Medicare, you're getting a lot of that paid for you up front. So I love the fact that, yes, I wish it was free. We all wish everything was free, right? Unfortunately, the world doesn't work
It's
that
not
way.
where we live.
No, but I love the fact that they can get coverage that really is good. And I'll just say it this way: if I could go on Medicare today, I would go on Medicare today.
100%.
You and I are lockstep on that one, aren't we?
Yes.
So, I think another thing, and again, how they cost contain, and I kind of mentioned prior authorizations before. What am I even talking about there?
Well, it's funny that people like to bring that up a lot. Is this plan going to be hard for me to get? It's all managed care.
Right.
That's my answer.
What
It's
is
all
managed
care.
care?
It just means that someone is in charge.
Yes.
Your doctor is
Yes.
in charge. It's your doctor and the health, the company,
insurance company.
the insurance company that you're working with. And probably some of them do say yes more often, some of them don't. There's no straight answer for that. And I always say to people, look, if it's something that's medically necessary, your doctor should be able to find a way. It's not like there's this gatekeeper, who's saying absolutely not to things that are absolutely necessary. So, and yeah, sure, some of them are probably more challenging than others, but
Yeah, I mean, I'll share a personal. Obviously not on Medicare yet, but like I had a knee issue not too long ago, and I was like, I want to get an MRI, and they were like, no, you can't get an MRI. You got to do physical therapy first, right? Because it's more cost effective, right? So I did physical therapy. It didn't solve the issue. So then it was elevated, stepped up, and I think that people would love to get what they want
Sure.
when they want it, and they
Right.
hate that process. But generally, like, I've been doing this a while. I can't think of circumstances where it's been more than the number of fingers on this hand where somebody really hasn't been able to get the service
Right.
or opportunity that they
Yeah, it's
needed.
not a complaint I hear very often. I mean, I've been at this for 5 years and I rarely get a call saying, I'm going to change my plan because they're not approving things or whatever. You just have to remember it's managed care and you have to go through the steps, which, if you think about it, is the right way to do things anyway.
Absolutely, that keeps costs down. So in the month of love, and for some people, I guess hate, right? In the Medicare world, love is, doesn't cost much.
Right.
Free is great. No cost is awesome. Nobody telling me what to do.
Right.
Not having to go through prior authorization. So there's a lot of stuff in the Medicare world. And again, I love the fact that we really consistently are working on getting this information out to people.
Mhm.
So you've been with us now, Dawn, a little over 5 years, as we mentioned earlier, and you've literally talked with thousands of people on the phone. And I know from my position, one of the questions I always get is what does an appointment look like with one of your benefits executives? Like exactly what would I walk through? How long would it take? So what we thought would be great to do today is to actually bring one of your calls live on. It's a 30-minute call. We don't have time for that, obviously, but we're going to play a few excerpts and just talk about it because I do think it gives people a good idea, especially those that are watching today, of what the process could look like for
Sure.
them. Awesome.
So I have a little bit of information for you. It looks like you're turning 65 in October. Is that correct?
Yes.
Okay, perfect. And are you still working?
Unfortunately, yes.
Okay. Are you going to work after you turn 65?
Yeah, well, I figured I'd work till my birthday's on the 6th, so I
Okay.
figured I would make my last day October 31st.
So first thing I love about that call is you said I don't know very much about you. And the reason that is a lot of people don't want to give information up front, right? So you're doing a needs analysis there in an essence. So just talk about what that looks like in an appointment on a call.
Sure, just finding out where they are in their Medicare journey. Are they, approaching 65? Sometimes they're past 65. They kept working. They're trying to figure out whether or not they're going to keep working or if they're going to keep working, keep their, which insurance, things like that. So it's just a kind of a fact finding mission to figure out all those little details that we need.
Yeah, so we never rush to a solution without knowing what the situation is, right? You can't bring a solution when you don't know the situation. And I know for every one of us, that's where the calls start.
Yeah.
Let me understand exactly what's going on with this individual. And I like the word you used, their journey, because it really is. Once we understand their journey, we can walk them through the process.
Right, exactly. Make sure they hit their deadlines, they stay on top of things like they're supposed to, and
Why is it important to hit the deadlines?
we don't want them to get penalized.
You got it. We don't want them to make any mistakes.
Right.
Now let's listen to the same call, but we're just going to walk through a few excerpts from the call.
Sure.
Advantage plans in your area, and you've got a lot of good $0 options, so they can be really inexpensive for you.
Because my biggest thing is I want to be able to keep my current doctors,
Sure.
and they're in Bergen County.
Okay.
So, I've always, like, through work, I've chosen,
The plan that works with them.
the plan that allows me to pick my doctor and not be limited to a list.
Yeah. So, they're within the, if you would decide to go with Medicare Advantage, which is the lower cost option monthly, okay, there are usually two choices, two directions you can go. One is HMO and the other is PPO. And the HMO plan is going to make you stay within a bubble, within a network of doctors, and you don't have coverage if you're outside of the network, where a PPO will give you more options. So I usually recommend the PPOs, but I also will check your doctors to make sure they're going to be in any network that we're looking at.
Yeah, so this is not a surprising question or assertion, right? Like I've always said, people will be much more willing to change their insurance
Oh, yeah.
than change their doctor.
Sure.
Right? Because you're talking years of experience, comfortability, trust, all of those things.
Right.
On a normal call, how big of an issue generally is this?
Issue?
As far as how important is it to them?
It's the first thing we talk about. Well, it's usually their medications. And then what I like to my workflow is usually medications first to kind of narrow down a few plans in the area. And then we'll plug in the doctors and make sure their doctors are going to be a network for anything that we're
Right.
looking at. Something I thought was interesting that she asked was she mentioned that her doctors are in a different county. And that's something that people often think, well, my doctors aren't right here where I live. Can I still go there? Which, is just another thing to factor into their plan choice.
Yeah, and I know because of limited time, you talked with her about Medicare supplement as well, right? Which if they go with a supplement, then the network's wide open, right? How come?
Because they're accepted anywhere that Medicare is accepted.
Yeah, so if they go with a supplement, because Medicare's primary, they can go anywhere Medicare is accepted. If they go with an advantage plan, that's when you get into that HMO, PPO world. But again, one of the things you guys cover thoroughly, and you do a lot, is making sure that those doctor networks are solid for them.
Absolutely. Yeah. The last thing you want to get a call about is I signed up for this plan and no, my doctor's not in network, and I don't want that to be on me.
Yeah, that's a big problem, right? So again, for us, and we always start with prescriptions. I think that's smart. Then we go to physicians, right?
Right.
And we make sure those two things are right before we ever get into plan benefits.
Yep.
So now we're going to check out another clip as we continue to walk through this call.
That's the Advantage. I kind of look at that as the pay-as-you-go version, pay-as-you-go option, which is what most of us like to do. We need something, we buy it, we pay for it, right? Medicare Supplement is the other product that you can put in place. That's a little bit more comprehensive in that if you go with a Plan G, which is kind of like we call it the Cadillac supplement plans, once you pay your monthly premium, you don't have any copays with that one. So you'll have a small deductible for the year, and that varies from year to year. This year it's $257. And then you don't have copays. So you could have doctor's visits or tests, a hospital stay or whatever you would need, and you don't have any copays. The other thing you don't have with the supplement plan is you really don't have any networks. The network is anywhere that Medicare is accepted. So some people like that flexibility to be able to say, I want to go to this doctor or, that doctor, but really depends on a couple things like your budget and your health needs.
Yeah, so I mean that's basically it in a nutshell. I know I
Yeah.
do a lot of seminars, right? And I always talk about one of these isn't right, one of them's not wrong.
Sure.
They're different, right?
Right.
So when you're presenting that, you're really trying to help them in the simplest terms kind of understand what they're getting, right?
Yeah, absolutely.
Yeah.
Yeah.
So from her perspective, she had some questions about the Advantage, didn't really because again, time with the supplement. How do you see that most people respond to those options?
They usually just have more questions, if honestly what it really comes down to 9 times out of 10 I'm going to say is price. It's
Yep.
going to be your budget.
Yeah.
And I'm not there to twist your arm. I'm there to help you make an educated decision. If your health needs warrant a supplement plan because you're a little bit more medically needy, if I can say it that way, I might, I would definitely present that option, but most people are going to go with what's in their budget right now, and 9 out of 10 of us, it's going to be the Advantage plan.
Yeah, and for me, that's one of the things that drives me nuts because we write a lot of supplements, we write a lot of Advantage plans. I hate when people say, you should never do an Advantage plan.
Yeah, they don't
Right.
say never to either.
No, because at the end of the day, some people truly can't afford.
Sure.
Like, I think if everybody had $400 to $500 a month to spend in premium, the majority of people would go with a supplement.
Sure.
Because as you mentioned on the call, which I actually love the term, that's the Cadillac coverage.
Right.
Right. You're getting high quality medical coverage, not much out of pocket costs.
Right.
A medical emergency is never going to become a financial emergency.
Right.
Right. But the reality is for some people, that $200 that they're taking out of your Social Security is a stretch for them. So
Right.
it does come down to finances, but we're always presenting both options.
Absolutely.
Yes.
Yep.
So that people can make the right decision for themselves.
Yeah.
So, if you have some concerns that way, there's, maybe you lean towards the supplement plan, or you can also, and I recommend that you add, a cancer policy, or even you can add like a cancer, heart attack, and stroke policies, things like that. Kind of builds the complete package for you to make sure that you're well covered in the event of, anything catastrophic happening.
Those things aren't covered under the regular.
They are. Yes, they are covered. The main difference, but we always like to think of it like, if you were diagnosed with something like a cancer, there's obviously a lot of expenses that we don't even think about. So your medical would be covered under a supplement plan. It's going to cover a little more comprehensively because things like chemotherapy and infusions, they're covered. They're considered what's called Part B drugs. So B as in boy and not D as in David. So Part B drugs under a Medicare supplement plan are covered. And under a Medicare Advantage plan, they have a 20% coinsurance.
Yeah. So again, I love this from the standpoint, as we talked about, as we're going through this call, there's two options, but at the end of the day, we're trying to get them the best coverage for a cost they can afford.
Right.
Explain a little bit more about the dialogue you were having with her there.
So she was concerned about certain issues like your maximum out of pocket, which we like to say that most people don't touch their maximum out of pocket. That's the most you can spend in a year without having something catastrophic like a cancer diagnosis, because there's a 20% coinsurance on an Advantage plan. But we have additional products that are optional, but they just provide a nice, neat package for you. If you go with Advantage plan, you put some cancer coverage in place, it can help mitigate some of that out of pocket for people at a much lower cost than the premium for a supplement can be. So it's kind of the best of both worlds. I was just trying to make sure that, she understood both options.
Yeah, no, I think that's great. And this probably isn't the best phrase, but it's the one that's coming to mind right now. There's a lot of ways to skin the cat, right? And, I know people don't like to think about skinning cats, right? So, we're not being morbid here. But so yeah, she could go supplement and get that comprehensive coverage at that price tag. She could go Medicare Advantage, add a couple of products, right? And get supplement-like coverage for a lower cost. And again, just want to be absolutely clear. One's not right or wrong. They're just different. And what you were trying to do is to really help her understand her options so she could make a good decision.
Absolutely.
And what did she end up doing?
She ended up with a Medicare Advantage. I don't remember if it was a $0 premium, but she went with Advantage, and she went with a hospital indemnity with some cancer coverage, just to make sure she was well covered.
Bring some more completeness. Awesome.
Yeah.
And I think this is the final clip that we have today. But again, I think it's been great exercise to walk through what a call looks like. And again, we've left a lot out because of time, but give people a basic gist. So let's see what this next clip says.
So, because Medicare will start or can start the first date of the month of your birthday. So for you, obviously that's October 1st. But if you're covered under your employer, or you want that to align with when you're starting to receive your Social Security benefits, you certainly can do that. You can just postpone and say you want so what you'll do, if that's the case, is when you fill out your forms to start your Medicare, you'll ask for an 11/1 start date. So November 1st. Okay.
So this is very common. Sometimes people are retiring in the middle of the month. They're trying to figure out, how do I not have a lapse in coverage, right? So for her, she's just trying to figure out when is the right time to start. And again, walk us through why that's so important.
Well, once you start your Medicare, you're going to be charged your Part B premium. And it's not necessary to be paying your Part B premium and be covered by your employer coverage. So if you don't want to be paying for both, most people don't want to start it. It's nicer to have everything line up. So if we can start everything the first of the next month, that usually works out a little bit better. Most people, their employer coverage, sometimes your employer coverage will end the day you retire, but a lot of times it does continue to the end of the month.
Yeah, I think it was interesting you brought up the October date there, because a lot of people are like, well, I have to do this. And honestly, they're used to it, right? Because that's when their employer enrollment periods are. But she was not locked into October deadlines or December deadlines, was she?
I don't think so.
Why not? Because she was new to Medicare, right?
Yes.
What happens when you're new to Medicare?
You can leave your employer coverage, and that's just that gives you your initial coverage, your initial enrollment period.
Yeah, so you're basically getting an enrollment because you're new to Medicare, and you're not beholden to the annual enrollment period.
Exactly.
Yeah. So obviously client experience is huge for us, right? We want people to have an experience that's different than anything they've had before, right? Where things have been thoroughly explained in a simple way, where everything's been checked, where they get off the phone, they're like, wow, that was super helpful. And, we get a ton of Google reviews that reflect that. And you, Dawn, have gotten a ton of them, I don't know. We've got over 2,000. You've got a good number of those. So we appreciate you. We appreciate all the hard work that you do for us and for the team. But I do want to kind of read this one and walk through it. So, and if you're listening today or watching the podcast and you have a question or something you want to add, we would love for you to do that, because we would love to follow up with you on a call to action or something with that as we move forward. But here's the Google review. And I'm going to break it up a little bit because I think little explanation needed. This was a very helpful task, and Dawn Clark did a wonderful job for me. So, helpful task. Why do you think they're communicating that way? What do you think this person meant?
They needed to check it off their list.
Yeah.
They needed to make the call, and they probably were.
Yeah.
Yeah.
I'm thinking helpful is difficult. I didn't know how to
Sure.
do this, and I needed someone to help me with it, right? Yeah. So she answered all my questions and made me super relaxed to complete my needed task. There's two things there. I love the fact that there's the actual insurance that needs to be selected, but there's also the emotional component. Can you speak to that for a minute?
Yeah, that's my favorite compliment when people say, you really made this easy for me. One of the first things I like to say to people is just relax. I'm going to hold your hand through this process. We're going to get through this together, and it's 9 times out of 10, it's not what they thought it was going to be. It's much easier.
Yeah, I mean, back in my days of actually doing what you're doing now, I got a ton of referrals, and it was never, you're the smartest person I met with Medicare. Yeah. That was never the referral, right? It was, you made this so easy. What they felt overwhelmed or was a daunting task, which is tasks, a word they've used a lot here.
Right.
It doesn't have to be.
It doesn't.
No. All right, let's pick it up. It says, I know I put this task off until the last week of enrollment, but I volunteer my time. But Dawn was super helpful to me since the pressure was on me to complete this task during the week. So again, human nature, right? When we have to do something that we don't want to do or are not comfortable doing, what do?
We put it off.
We don't do it, right? We wait until the last possible moment. And I'm sure you hear that a lot. Yeah. Right? Yeah. And I'm sure it drives you a little crazy sometimes because time is...
We have windows.
Yes, there's only so much time. But again, how long did it take you? I know this specific call, you can't give me minutes and seconds, but like how long does it normally take for you to help someone through this process?
Start to finish, we can do it in 45 minutes. It depends on a couple of things, how challenging your case is, how many questions you have.
Yeah, and if you have all your doctors written out and you don't have to be, I think I see Dr. Johnny over at and you have your medications and all your dosages. Yes. So then he goes on to say, I cannot say enough about Dawn Clark. Thank you, Dawn Clark. I mean, when they're using your name multiple times, you did good. You made my day bright. So how does that make you feel?
That's great. It makes me feel like I'm doing what I need to be doing.
Yeah. And again, for me, I've always loved that about this job is it is complicated. Yeah, every once in a while I'll run across somebody that doesn't need help, but that's like a needle in a haystack. Yeah. For most people, they really do need help, and the value add to them and the feel good to us is so worth it.
Yep.
Awesome. Well, you've been great today.
Thank you.
I appreciate, and not just great today, you're great every day. You're one of our top agents. You have been for years, not only in the production or the number of people you help, but the feedback we get from those people. So we appreciate your time today.
Thanks.
And if you had any what's your takeaway, like from today's podcast? Like, what would you want the watcher or the listener to know from your perspective?
Just that we're here to make it easy for you. And, I pride myself on education and making it simple. And I said, that's my favorite compliment when someone says to me, you made this so easy. I thought it was going to be all of this. And I like to take big pieces and make them much more manageable for people. And so if I can do that, I've done my job.
Yeah. And you're an expert, right? And one of my favorite sayings is, how do you know somebody's an expert on a topic? When they can speak really intelligently about it and use big words? No. Somebody's an expert on a topic when they can take something incredibly complicated and complex and make it so simple that anyone can understand it. Or in the words of my mom, which I've said many times, put the cookies on the lower shelf where everybody can reach them.
Well, that's good.
Thanks for watching this episode of the Medicare Made Simple podcast with MediConnect, and I'm Lance O'Brien. If you're looking for more content Want to get more education, you can go to our socials, Instagram, Facebook, LinkedIn. You'll be able to find a lot of information there. You can also go to our website, MediConnectinsurance.com. We have blogs, other information that you can receive there. If you just have questions, you can give us a call at 888-818-6334. We're committed to getting great information to you in simple forms. So reach out on this channel for more content as it's delivered.